Time now 9:22, starting Monday. Teachers and support staff working in Louisiana schools and daycares will be eligible for the coronavirus vaccine. Children's Hospital's Thrive Kids initiative will serve as a vaccination partner for New Orleans area schools. We're joined this morning by Dr. Amanda Jackson, Vice President of Physician Services. Good morning. How are you?
Good morning. Great. Thank you.
So let's talk about this. And we were just talking very briefly there in the break about the fact that teachers are now coming into the fold of eligibility for vaccination. Is this kind of a surprise, or this kind of makes sense in the timeline of how things were expected to play out?
This absolutely makes sense, and we were anticipating that this would be the next population of people to be eligible for vaccination. You know, when we look at who we need to vaccinate, we need to vaccinate our medically vulnerable population, which is why we started with our older population and also our healthcare workers that are on the front line of caring for patients with COVID. And now we're moving to our educators that are on the front line of working with all of our children. So absolutely, it makes sense that this group now is eligible for vaccination.
So I know there's going to be a lot of teachers really across the state that are wondering, what should we do? Do we need to run out and try and put our name on a list at a pharmacy? Is there some sort of coordinated effort where they can get it within the schools? What's sort of the game plan for this?
So we do want to coordinate how we're handing out the vaccines, because the state allocates how many vaccines each provider gets, each hospital, each medical provider gets. So we want to coordinate it so when you go to get the vaccine, there's vaccine for you to get. So Thrive Kids and Children's Hospitals is closely working with all of our individual schools to coordinate that vaccination delivery. So if a teacher or an educator would like to have the vaccine, which we strongly encourage, they should work with their schools, and we will work with the school to make sure that they get an appointment for vaccination.
Well, all of this really, when you think about the fact that the governor says we should be getting the largest delivery of doses that we have so far, it really makes sense to spread it out. What are you hearing from the teaching community about how much this means to them?
It's been a great response, and the educators, and in fact, the entire community has really asked for the vaccine, and there's been a large demand for the vaccine. And as a pediatrician who has made a career of giving vaccines, it is delightful to see the engagement with our community in getting those vaccines delivered. This is really how we need to care for our population.
Lastly, I mean, we all love our children so much. I mean, some of the most important parts of our families, really. What sort of difference will this make for the children and their education going forward?
And that's the biggest thing. I'm a pediatrician and a mom, and I want my kids in school and I want my kids learning. My mom's a teacher. I also need my mom protected so that she doesn't get sick. So the whole effort is to get everyone back in the classroom, back to learning, and back to being with one another.
All right, Dr. Amanda Jackson, thank you so much for joining us this morning. A big step toward having all of the kids back in class, I'm sure.
Absolutely. Thank you so much.